This is imaging of the hip labrum. I'm Pat Battaglia from Logan University. First, some background anatomy. The hip or acetabular labrum is a piece of fibrocartilage that encircles most of the acetabulum that you see here and is immediately adjacent to the hyaline articular cartilage that'll form part of the that will form the hip joint. Note also here for reference the transverse acetabular ligament. So the acetabular labrum combined with the transverse acetabular ligament function to encompass and seal the femoral head, deepening the hip joint itself. Although the acetabular labrum encompasses the entirety of the bony acetabulum, when we image it in sectional imaging, the acetabular labrum is usually demarcated as a triangular structure, regardless of anatomic section. To make sense of the imaging anatomy, we're going to zoom in a little bit and study it in some detail. So here's a depiction of the close-up anatomy of the acetabular labrum. Let me walk through a little bit of the more finer points to explain what we see at imaging. And once we can establish the normal anatomy, we can make sense of the pathoanatomy that we see in our deranged labrum. Number 3 here is the fibrocartilaginous labrum itself, demarcated by A, 3, and 2. 3 shows you the mediolateral dimension, and then 2 shows you the width of the labrum here. So all of this triangular structure is the acetabular labrum itself. Again, it's fibrocartilage. Now note here this sort of divergence of the labrum at the rest of the acetabulum. This piece of anatomy here, represented by B, is the hyaline articular cartilage of the acetabulum. So this is where the femoral head would articulate. So this is hyaline articular cartilage, this is fibrocartilage, and then here, item C, is the transition zone between the hyaline articular cartilage here and the fibrocartilage here of the acetabular labrum. So there's a bit of a transition from hyaline to fibroarticular cartilage. Over here, item D is the bone of the acetabulum. And then here, item E is what's called the tide mark. It's the smooth transition that's seen between bony or cancellous anatomy and hyaline articular cartilage. So this transition point of bone to cartilage is oftentimes termed the tide mark. That's what's demarcated here as item E. Item 1 shows you a recess between the joint capsule, which is F here, and the acetabulum. And then item H here is direct anchorage of the acetabular labrum to the bony acetabulum. Note also there's some neurovascular anatomy here. This is the most vascularized portion of the acetabular labrum. Understanding this anatomy helps understand the normal imaging appearance. So if I were to zoom in on the acetabular labrum, we can appreciate this dark triangular structure is the fibrocartilaginous labrum. This gray anatomy here is the hyaline articular cartilage. This sort of intermediate signal intensity zone is that transition point between the fibrocartilaginous labrum and the hyaline articular cartilage. This anatomy here is the cancellous bone of the acetabulum. The dark black is the subchondral bone, or the tide mark. And then lastly, the overlying joint capsule. Also note the recesses, in particular between the capsule and the labrum here. And sometimes it's not abnormal to have a recess mimicking a labral tear in between the fibrocartilaginous and hyaline articular cartilaginous portions of the labrum. The function of the acetabular labrum is as follows. First, the acetabular labrum does not participate much in load transfer through the hip joint. Only 1 to 2% of load is transferred, or bore rather, on the acetabular labrum with normal activity. This can get up to 11% in hips that are dysplastic, but nonetheless, a low amount of load transfers across the hip joint through the acetabular labrum. Rather, the main function of the labrum is to protect the cartilage to reinforce the cartilage of the femoral head, the hyaline articular cartilage. Its main role is to form a tight seal around the femoral head, reducing cartilage stress. It also deepens the femoroacetabular joint, thereby maintaining stability of the joint. And this stability will also limit stress on the cartilage. This is why labral tears can accelerate the process of osteoarthritis of the hip joint because of the cartilage damage to the femoral head. So the main role is not to transfer load to the hip joint. Rather, the main role is to protect the cartilage of the femoral head during normal activity. Unsurprising when you consider the physical exam for suspected labral tear, peak strain throughout most of the labrum, especially the posterior and anterior components, occur at 90 degrees of flexion plus adduction plus internal rotation. To image the acetabular labrum, there are a number of options to consider. I've outlaid a few of the more commonly chosen ones here. First, MR arthrography, usually with 1.5 Tesla imaging, is used. However, with the rise in popularity of 3 Tesla imaging, the need to inject contrast into the joint becomes less and less. Said another way, 1.5 Tesla MR arthrography is comparable to 3 Tesla non-contrast MR imaging in its performance for diagnosing labral tear. So if you have the option to get 3 Tesla MRI or 1.5 Tesla MR arthrography, your patient will probably prefer getting the non-contrast 3 Tesla MRI to avoid getting a big needle stuck into the hip joint. Both are comparable in their diagnostic performance. Slightly inferior, but still useful, especially if MRI is not an option for your patient, is CT arthrography. The CT arthrogram has pretty good diagnostic performance in the diagnosis of acetabular labral tear. Inferior to these imaging modalities, but emerging, is ultrasound imaging. The main limitation of ultrasound of the acetabular labrum are going to be patient body habitus, so bigger patients should not undergo ultrasound imaging for labral disease or location of labral tear. Thankfully, in the acetabular labrum, most of the tears occur at the anterior superior portion. Therefore, this is readily accessible with ultrasound imaging. This is in contrast to the glenoid labrum, whereby most of the tears at the superior biceps anchor are not readily accessible by ultrasound imaging due to the overlying bony anatomy. So when we discuss ultrasound imaging of labral tears, it is much easier to identify an acetabular versus a glenoid labral tear due to the location based on probability of where the tear will be and the subsequent accessibility due to the acoustic window from the ultrasound exam. So ultrasound has intermediate sensitivity and specificity compared to CT and MR for the diagnosis of labral tear. If it's your only imaging modality, you may get lucky if the tear is in the right spot and if the patient has the appropriate body habitus. But it should not be your mainstay or gold standard imaging for acetabular labral tear. In addition to advanced imaging, appropriate radiographs shouldn't be overlooked in the evaluation of a patient, in particular an athlete with suspected labral tear. And in addition to your routine radiographic series, there are a few special views that should be ordered in all patients whereby there's concern for femoroacetabular impingement that's symptomatic with subsequent labral tear. These views are the Dunn view, seen here with the patient's hip flexed and adducted to best profile the presence of a cam deformity, which is osseous protuberance at the femoral head neck junction, and a false profile view, which is essentially an oblique pelvis view meant to profile the acetabulum in relation to the femoral head, looking for acetabular protrusion and acetabular over and or under coverage in the setting of hip dysplasia or pincer deformity. So both the Dunn view and the false profile view are effective ancillary radiographic views, in particular if there's going to be some sort of surgical planning for your patient's symptomatic femoral acetabular impingement. I say symptomatic because a number of patients have false positives on these imaging modalities, so clinical correlation is a must. As far as imaging pathology of acetabular labral tear, I'm going to show a few MR, including MR arthrography and ultrasound cases. In a typical or classic sense, this is what will be seen in a degenerative acetabular labral tear. One, there'll be contrast dissecting through a cleavage plane of a degenerative labrum that you see here. And two, very commonly, there will be associated collections outside of the labrum. Now, in the setting of a contrast exam, this may be a collection of contrast material. In the setting of a non-contrast exam, this may be a synovial paralabral cyst, signifying underlying tear in the labrum and loss of containment at the hip joint. So mixed signal intensity or mixed appearance to the labrum, cleavage planes, maceration, signal or contrast extravasation, and paralabral cyst or fluid collections are all stigmata of labral tear. When that's visualized, make sure to go evaluate the adjacent hyaline articular cartilage. In this case, there's extensive thinning of the hyaline articular cartilage here and over here compared to here, not unsurprising considering the degenerative nature of the labral tear. Here's another case of labral tear on MRI from Radiopedia. We'll give credit to the contributor. Here. And this is the fat-suppressed post-contrast image in the coronal plane. All imaging planes are helpful, coronal, axial, there's even an axial oblique plane, which is commonly used to evaluate the acetabular labrum. I think if we're discussing ease of image interpretation, especially if we're not used to interpreting a lot of MR of the hip, the coronal plane is probably most familiar to us, so I'm going to emphasize that plane. So here's a coronal profile of the hip, and I'll just scroll through to let you appreciate the anatomy. This is anterior. There's the psoas major tendon surrounding iliacus muscle. Now we'll come posterior through the acetabulum, femoral head, and posterior aspect of the hip joint. Here's the transverse ligament and ischium right here. The normal acetabular labrum is a dark black triangle anchored either to the bone or to the hyaline articular cartilage. And if you look at the superior portion, you appreciate a couple of things. Number one, the labrum is no longer a well-demarcated triangle, but rather it's enlarged and rounded. And two, there's central internal signal intensity or brightness, in particular right here throughout the labrum. Like most musculoskeletal structures, acute isolated trauma is rare, especially in the setting of athletics. More so, it's a degenerative phenomenon where there's mucoid degeneration of body tissues and loss of normal strength and integrity. And that's the case here in the acetabular labrum. There's internal signal intensity signifying mucoid degeneration, linear high signal suggesting tearing, and surrounding cyst collection out here and maceration of the labrum right here. So no longer a well-demarcated black triangle with clear demarcation with the hyaline cartilage, rather this irregularly shaped mass with internal and surrounding external fluid signal. Here's another case from Radiopedia. We'll give credit here. Coronal T2 fat suppressed image of the pelvis. This is anterior. Here's the patient's right hip. Here's the patient's left hip. Out the iliac fossa with psoas tendon and muscle. And note on the right side there's a cystic mass decompressing within the iliac fossa. If we follow that mass posterior, we see its communication coming from the acetabular labrum. So I'll remind you the labrum wraps around the entire hip joint. We usually see it at its margins here, but it does wrap around the entire hip joint. So right here is approximately where the tear has occurred, and the cyst is decompressed synovial fluid from the hip joint itself, loculating and collecting within the iliac fossa. If we try to look at a different imaging plane, this is the axial plane. Now here is the cyst, and we'll follow it down to this degenerative and torn labrum. Look over here for comparison. There's a nice triangular piece of anatomy firmly anchored to the hyaline cartilage or the bone. Whereas on this side, we've lost that triangular, clear demarcated structure because there's degenerative tearing of the acetabular labra with cyst formation. Another case from Radiopedia. We'll give credit here. Coronal T2N image of the pelvis, right hip, left hip. We'll scroll through the right hip. And you appreciate again a cyst coming from a region of heterogeneity within the acetabular labrum. These paralabral cysts are common and they are clues that there's an underlying labral tear. If we look in the sagittal plane, here is the innominate and the femoral head. I'll scroll through and you can appreciate, again, the labrum wraps around the hip joint here, around the acetabulum. Here's the anterior portion. there's the posterior portion. Oftentimes, a clock face is used to describe the location of the tear, with 3 o'clock being anterior. So you can see at about the 12 o'clock position here, there's internal heterogeneity, thickening, and a labral cyst forming in the region of labral tear. In addition to MR and CTA, ultrasound can show labral tear. Here's a young endurance athlete with progressive anterior hip pain. The ultrasound exam demonstrates a few characteristic findings of labral tear. Number 1, a paralabral cyst collecting immediately adjacent to a region of labral calcification. Number 2, heterogeneity of the acetabular labrum. In the young lacrosse athlete with persistent groin pain, here's another example of labral tear. Instead of being a well-demarcated thin triangle, the acetabular labrum is extensively thickened with internal heterogeneity of the echo pattern within the acetabular labrum. With the application of joint traction, you'll appreciate a cleavage plane of the acetabular labrum. Right at the end, there's a clear cleavage plane, which should not happen, separating the two components of the labrum, signifying a loss of integrity. Hip dynamics are being studied more, both under MR and ultrasound imaging, to evaluate the potential improved sensitivity of labral tear detection. Well, that's a brief overview of imaging of the hip labrum. I hope you found it valuable.